With a complete lockdown that has been set in place on Sunday, we're here at Anna Salai, which is one of the most prominent locations here in Chennai, which you can clearly see is completely deserted. This given that Tamil Nadu has mandated a total lockdown on Sunday. This apart from important and essential services such as medicine, as well as essential services like Secy, Zomato and others who will be allowed on the roads provided they do have a mandated pass. Tamil Nadu government has stepped up night curfew starting yesterday, as well as complete lockdown on Sunday over here in the state following the rising number of COVID cases, with almost over 300 checkpoints that have been set in Chennai city alone. We are here at one of these locations, which, as you can clearly see, police officials are checking for all the people who are traveling outside on the roads for either the passes or checking if they do have the mandate that is necessary for them to travel in. Other than essential goods and services, all other people who are seen violating these rules and regulations will have to pay a fine, as well as they will be charged given that they are violating lockdown regulations and restrictions that has been set in place not only in Anna Salai but also across major junctions here in the city. Checkpoints have been set in place to give that rising COVID cases have been seeing a worrying trend of increase here in Tamil Nadu. Yesterday alone, Chennai recorded almost over 5,000 new COVID cases and over 10,000 plus COVID cases, new COVID cases that had just been recorded in Tamil Nadu yesterday alone, with rising cases of both Delta and Omicron here in the state of Tamil Nadu. Night curfew has been set in place from 10 p.m. until 5 a.m. as well as Sunday complete lockdown that has been mandated starting today, with video journalist Prasad Apurva Jayachandran for Republic. Here with Tamil Nadu's Health Secretary J. Radhakrishna. Sir, thank you so much for speaking with the Republic. Sunday, total lockdown has been, starting today, it has been implemented. So far, how has the lockdown gone, be it the night lockdown as well as today starting?
See, basically, at present the lockdown is one measure with a view to prevent the spread of the disease. It's not the only measure, one of the many measures. So we are focusing on two issues. One is preventing the spread, because every day roughly around 2,000 new cases are added, though we are increasing the testing. But still, we cannot run away from the fact that, Omicron cases are the main dominant. Yesterday's whole genomic testing also revealed around 86% of the new positives are Omicron. Second is, we are also looking at clinical management. So to prevent, at present only 7% occupancy is there. Overall occupancy of hospital among the active cases is 15%. ICU occupancy is 1%, and oxygen support is on 6 to 7%. Having said that, in Tamil Nadu, both Delta is also still not totally over. So we have to be careful. So this lockdown, to an extent, and night curfew in fact sensitizes people that there are issues, because generally there is a feeling that Omicron means it's a very light disease, we need not take it seriously. So the absence of masking, and more importantly, many asymptomatic and mild cases are coming, so but they are capable of spreading to others. So to that extent this has helped. And except we have been checking, except for exempt vehicle travelers and those who are supplying food and all others, so far there has been no major violation. People have understood. More importantly, it has sensitized them to the challenges.
Sir, the positivity rate for COVID has been continuously increasing here in Chennai. Almost over 10% positivity rate has increased. We had been somewhere around 1.5%. Now over 10% has been increased, be it in Chennai as well as in Tamil Nadu as well. Yesterday, of over 10,000 cases, 5,000 alone were from Chennai alone, the new cases. How are we seeing this to be curbing these cases, or are we yet, this is just the start before we see more rise?
See, the experts, including National Institute of Epidemiology, constantly advise, have been telling that, we are going to have a vertical rise of cases, which anyway we have seen. But always what I have seen, even in the first two waves, initially it is in Chennai, then slowly when Chennai starts tapering down, by the time Chengalpet, Kanjipuram, Tiruvallur show up, then southern districts show up, then we also have the challenges of the western belt. So we are assuming, while sensitizing public not to panic, we are also assuming that we may have increase of cases. We are ensuring that adequate screening centers are there. so that everybody need not rush to the hospital. Those who are double vaccinated and asymptomatic, after a routine blood test in a screening center, if they are found to be okay, we will allow them either home quarantine or keeping up in COVID care center. But public needs to understand that this follow-up of this COVID appropriate behavior is going to be the real clinching factor. First two waves were controlled because public started fully adopting and believing the COVID, the control public health measures.